Hello, everybody.
Okay.
So we're going to talk about our research now. There's certainly some similarities between the findings that have been presented already. If you can move to the next slide, please, Yolanda. Thank you. So we did a mixed methods piece of research, and we've shared with some of you already the quantitative phase that I'm going to be talking about now before passing over to Yolanda to talk about the qualitative phase. So we sent out a digital survey to North London residents. We distributed it via Facebook groups, via London Met's communications team. It was posted on London Met social media and website, and it also got picked up by some local newspapers. We collected the data for the whole of May, and we were interested in different factors that would predict adherence to social distancing. And we also collected data on self-isolation behavior, but we haven't yet analysed that data. So via the survey, we measured actual social distancing behaviours, demographic factors, housing factors, health factors, political factors, psychological factors, and social factors. So it was quite a long survey, and we incentivised participants to complete it because of the length. And we analysed the data using logistic regression modelling in terms of multivariate analysis, but then we also used some chi-squares and t-tests to look at some of the univariate associations between factors. We'll move to the next slide, thank you. Just as we've seen in the previous presentation, adherence to social distancing wasn't quite as it was being presented by the government and by various people talking about how fantastic the public's adherence to social distancing was. In fact, we found that in terms of all of the rules combined, that 93% of our participants were not adhering to all of the rules, but a lot of that was unintentional social non-adherence to social distancing, such as going out for shopping, going out for medicines, and in going out for those permitted reasons, coming into contact with other people. But of greatest concern was the intentional non-adherence, and that nearly 50% of our respondents intentionally broke social distancing rules over a 2-week period. Most of this was unpermitted leaving of the house, where a third of our respondents did this, and over a quarter of our respondents engaged in unpermitted meeting of others. So we used the regression model to predict, to look at the factors that predicted and that were associated with these two different types of adherence. So we modeled the non-adherence of all rules, and then we also measured we also modeled the intentional non-adherence of rules. So we're going to share those findings now. Next slide, please, Yolanda. So the factors that predicted non-adherence of all rules. So we found that the odds of not adhering to all social distancing rules increased if a participant was not identified as highly vulnerable. So in other words, those that were vulnerable were less likely to adhere. Those that didn't adhere had lower control over others' distancing, had lower control over responsibilities for which coming into contact with others was unavoidable, and if social distancing behaviours were reported after the lockdown was first relaxed. So we found that once, because during the month period of May that we collected data, there was a relaxing of the social distancing rules, and after rules were relaxed, violations and non-adherence increased after that. Next slide, please, Yolanda. But as well as these multivariate predictors, we also found that there were some univariate predictors that were associated. So although in our multivariate model, vulnerable health was the most important thing, we then also found that there were several factors that were associated with vulnerable health, including age, employment status of not being retired or long-term sick or disabled, not living with a person of vulnerable health, and lower intention to socially distance. So all of these factors were also associated with non-adherence to social distancing. And then factors that were associated...
Sorry, I am moving too fast, Stephen.
Yolanda, you want to get to your qualitative findings, I understand.
Yes.
So
Well,
the factors that were associated with lower control over others' distancing, and this was something that came up in one of the earlier presentations, was living in a rented room in a multiple occupancy house was associated with lower control over others' distancing, and also higher perceived susceptibility. So this was a counterintuitive finding, that higher perceived susceptibility was associated with non-adherence. So it was kind of, it seemed like it was going to happen anyway. So what was I'm going to catch COVID anyway, so I might as well not bother adhering to the rules. And then lower control over leaving the house and higher normative pressure with friends were also associated with lower control over responsibilities. Next slide, please, Yolanda. And then looking at the factors that predicted intentional non-adherence, the odds of intentionally not adhering to social distancing rules increased if a participant had a lower intention to socially distance, had lower control over others' distancing. Another counterintuitive finding, which suggested somewhat of an elitist perspective, and maybe is a bit telling in terms of the Dominic Cummings scandal, the Neil Ferguson non-adherence as well, had a doctoral degree compared to a master's degree, a professional qualification, bachelor's degree, or work-related qualification. More educated were less likely to adhere. Voted for the UK government compared to not voting for the UK government. Perceived high normative pressure from neighbours and had greater support from friends. Again, that last one being counterintuitive. We were thinking that support from friends would help people adhere, but maybe where there was a high support from friends, they were maybe more tempted to meet others when they weren't permitted to. So the last slide from me, please, Yolanda. Again, we added an extra layer of modeling to see what univariate predictors were associated with the multivariate predictors in our model. So vulnerable health was associated with intention. Interestingly, in this model, social responsibility and higher and self-interest became important factors, which is what you would probably expect when talking about intention. And then we had lower control over responsibilities. Normative pressure was still important. Higher perceived susceptibility was again a significant predictor that was counterintuitive, and then employment status was also associated with education status. So I'll pass over to Yolanda now.
Okay, thank you, Stephen. So as Stephen mentioned, this is a mixed method, and the second phase of the study was the qualitative interviews. So I just wanted to clarify that because of our research design, which is a mixed method sequential explanatory design, we started with the results from the survey, the quantitative results, and based on those results, we developed the interview guide only to explore those key issues that were identified previously. So we in-depth interview with 30 participants, and we stratified by gender, age, ethnicity, and borough. So in order to have a more or less an equal, I'm going to show that in a minute, a representation of our population sample. The period where we interview was around, well, the 5th of August and a month ago, the 21st of September. So I just wanted to draw attention to the context in terms of a government measure that, as you know, there were all the period of relaxation that we are seeing here. The last one was the rule of 6, for example. So this is the great period of confusion, if you like, in terms of and changes in the norms. And then we analyze using a framework analysis. This is because we had already preset construct applied from behavioral sciences. Just to give you a flavor of the sample that we interview, we have, as I said, tried to keep some equal as much as we could in terms of participants. One difference is that we had here we have 60% of participants being white, but in the survey we actually had only 85% were white. So well, we were trying to bring that in. The same applies to age and gender. Try to be a bit of equal. I put some notes there of the whole sample, just for you to know. You will notice, for example, we have 5.3% people unemployed only, and 12.2 living in a rented room or HMO. And that, what I'm trying to say is that unlike the type of probably population that you manage to reach out, especially in Health Watch or the work of Vanessa in Manor Gardens Trust, Welfare Trust, we are dealing here with, let's say, to round it up, people with a lot of social capital, if you like. This is a problem that has anything from the ONS and any open survey, unless you are working in particular and manage to reach out to specific groups, as Emma was mentioning. Any open survey, UCL or the one that we run, suffered from that. Okay, so the key explanatory behavioral domains that we were looking at, these are sort of translated into behavioral construct, as I said before, because it is social behavioral sciences. So we have trust, lack of trust in government. Attitude is a disapproval of measures, perceived contradiction. Knowledge, message being confusing and lack of clarity. Decision processes. This is self-evaluation of risk or self-interpretation of rules. So people here are weighing up the benefits and the losses of following the rules. So I think this is a sort of the decision process is very tied up with the notion of knowledge, attitude, and trust. But I don't have time to unpack that. But I thought it was an interesting sort of finding in overall in understanding intentional non-adherence. Then we have other issues such as emotion, the feeling lonely and isolated. I mean, these are the reasons why people say that they broke the rules. So this is what we're trying to understand, why people behave in that way. Perceived behavioral control, so caring for significant others or helping a friend or family member. Social norms, it was the perceived relaxation in the area. This is not the neighbor, but it's the area. So this notion of feeling of back to normal. So people were questioning what's the point in somehow in following or keeping up with the rules. And then environmental constraints or lack of support to perform the measures, in particular online food deliveries, on having bigger space or access to a garden. So intentions to comply, if the lockdown measures were reinstated, we see that this continued between the behavior, that decision process I mentioned earlier, and the intention. So you have some comments there from our participants. They say, I'll do as better as I feel I can. The issue of test for self-isolating was also an important one. I would self-isolate if there is a test, like meaning if there is no test or I don't have access to one, I'm not going to follow those rules. Measures identified in particular as unwilling to comply is if there is a reduction in the bubble, the rule of 6, or meeting friends in parks regardless of the rules, or helping a friend or meeting with a friend if need to be. Perceived barriers to adherence to social distancing. We have this individual level. I mean, this is important because I think that this is what we need to start working on. So, you know, from government to scientists trying to remove these barriers for people adherence. So unclear rules and messages, lack of mental health support, lack of personal advice, in particular of those that were shielding. They wanted support being early than it. Eventually they received some support, but they feel they need it earlier than it was provided. And then in the environmental side, resources, access to testing, deterrence practices. So people were asking more policing or fines for people who were not complying. online access to food and deliveries, manage social distancing in pubs and shops, restaurants, and cleaner parks. So this is because they perceive a higher use of parks, on green spaces, and increasing litter, but also some antisocial behavior as well, for which they needed, that led people having to move to other places and move to more distances, and they feel that if they had that provided, they wouldn't be sort of not complying with the rules. Perceived facilitators to adherence to social distances. I should say friends was one, but something that was mentioned before, I think it was Rosa mentioned, the community cohesion. And I think that was the key thing that this particular sample of this, our group, were valuing in terms of support. So neighborhoods and mutual aid groups. And just to cut it short, I mean, these are the expression on how much, well, they make use of them or how they value them. We have a third or around a third of participants being part of these mutual aid groups. Another third were saying that they were helping a neighbor during the pandemic with shopping and prescription and so on. And most respondents were aware of these mutual aid groups existent and feel they could resort to them if they're needed. So here you have a very low, sort of, they are not service user or clients from a voluntary sector organization, with very few exceptions, I will say. So in terms of the, I'm in 15 minutes now. So in terms of the, touching on the areas of potential intervention, obviously, like many of you have thought already, is this need of education at the individual level, or engage people, increase knowledge in terms of the particular behavior we are considering here is knowledge, trust, attitude, and the decision process that I mentioned earlier. And I think there's quite a lot of work there to be done strategically and co-produce with the community in order to restore this trust. And I think it was very interesting in what Vanessa also mentioned on how on people draw on fake news and how they circulate and so on. In terms of environmental level, it's again to facilitate or engage. We are here considering 3 different areas. One is trying to reach out, not necessarily to those shielding or being vulnerable, but also to other people living in HMO, on houses of multi-generational housing. So in order to access food or services, we consider also engaging in communities and park action groups in management and maintenance of parks, also working with or providing for mental health support groups or joining, linking with them in order to tackle environmental constraints and social norms and emotion for those more affected in mental health. So these are the groups that we consider could be a key stakeholder coming together. And finally, environmental health officer, perhaps working with small businesses. I mean, there's a need of clarification of the norms, but also to trying to understand the business concern perspective in order to make it more easy to them to implement particular measures to facilitate this social distancing, so people can feel that they can access pubs and restaurants. And here is about environmental constraints and social norms as well. Okay, so this is just to say that we have a report. I think that some of you will have circulated that. And then we have also a paper that is at the moment is under review, and there will be more to come.